Alright everyone, in this video we are going to go over how to place an oral pharyngeal airway, or an OPA. The OPA is a basic airway device that we use to help keep the airway open and unobstructed from our most common airway obstruction, which is the patient's tongue. As you can see, the OPA comes in a variety of sizes, so we will have to size and pick the correct one for our patient. Before we can place our OPA, we have to make sure that our patient meets the indications for placement of an OPA. So our indication for placement of an OPA is a patient who is not breathing or not breathing effectively, who does not have a gag reflex. Because of how the OPA sits with the tip of it in the back of the oral pharynx, if they have a gag reflex and we place this, it will cause the patient to gag and possibly vomit, thus compromising our airway. We also need to make sure our patient does not have any of the contraindications for placement of an OPA, the biggest of which would be having a gag reflex or massive maxillofacial trauma preventing us from locating our landmarks or being able to get that jaw open to place the OPA. Also, if our patient's jaw is clamped down to where we can't open it, we also will not be able to get an OPA in place. So, we're going to start with our adult patient. Hal has graciously agreed to be our patient. So the first thing we need to do is make sure that Hal does not have a gag reflex. There are two ways you can do this. You can either use the bite block and place it into Hal's mouth, stimulating the back of the throat to see if it makes him gag, or you can just measure and place your OPA, and if he gags as you place the OPA, remove it and go to an NPA instead. So in this case, I'm just going to measure and attempt to place our OPA. As we're placing our OPA, we should make sure that we have our other equipment that we're going to need. So you should have your BVM out and ready to go, or somebody getting that ready. And you should have suction ready also, in case your patient does vomit. When you stimulate their gag reflex, you can quickly suction that. So, to measure Hal's face for an OPA, you are going to measure from the center of his lip, or his maxillary incisors, to the corner of his jaw. So we'll start with the purple one. So center of the lip, here's the angle of his jaw. So that looks a little bit short. Let's try the next size up and see how that measures up. So here's the corner of his jaw. That looks pretty good. So now you're going to want to note what size OPA you have. So inside the purple one here, you probably can't read it, but you can see that there's raised lettering in there. That's what size your OPA is. You'll have to document that in your report. So the purple is 100 millimeter. The clear one here is 110 millimeter. Now we need to get Hal's jaw open so that we can place this. So we are going to either open his airway with a head tilt chin lift or a modified jaw thrust. Check the airway, make sure that there are no obstructions in there. If there are, suction till the airway is clear. Now we're going to open his jaw. So you're going to make an X with your thumb and index finger. And you're going to spread his jaw by expanding that X. We call it the X scissor technique. So I'm going to open his mouth with that X scissor technique. Now there are two angles you can insert the OPA. You can either insert it at a 90-degree angle or a 180-degree angle. What we don't want to do is insert it directly, because as you can see here, as I try and insert directly, it gets caught up. All I'm doing is pushing that tongue back into his airway, thus obstructing his airway, defeating the purpose. So for the 180 degree, you're going to insert the tip. You're going to feel it hit the hard palate, and it's just going to naturally want to turn itself right into place. Tuck it inside the lips, against the teeth if they have their teeth, Alternatively, if you prefer the 90-degree, insert the tip at the corner of the mouth and you'll feel it hit the hard palate and just naturally want to turn. Now if our patient gags, or if we've been ventilating for them for a while, they start to wake up and gag, to remove your OPA, you're just going to take and directly remove it, just following the curvature of the OPA. Once your OPA is in place, your patient's not gagging on it, now you can place your BVM and start ventilating your patient. Placement of the OPA differs when we are placing it on our pediatric patient. So our pediatric patient's airway is different from our adult airway in that proportionally their tongue is much larger to the rest of their mouth than in the adult. Also, their soft palate, or their hard palate, is not well developed, so we can actually damage it if we dig the tip of the OPA into it. So for the young pediatric patient, we are actually going to do a direct insertion, but we're going to use our bite block to help us insert this. First, we're going to open our airway. So to open an airway on our infant here, we're going to pad underneath the shoulders because their head is much larger in relation to their body. So we need to raise their body up a little bit to help open that airway up. Next, we are going to measure our OPA. Once again, center of the lips to the angle of the jaw. That looks like a good size for our little buddy here. So now you're going to take your OPA, check your bite block, and you're going to use your bite block to displace the tongue down to the side. Let me displace this way so you can see a little bit better. And then your OPA just right along the bite block until it is inserted. This mannequin's anatomy is a little funky, so it doesn't sit all the way in like it should. Now that our OPA is in place, now we can ventilate our patient. We've assured ourselves that he does not have a gag reflex, so we can leave the OPA in place. If your pediatric patient does gag on the OPA, we don't carry NPAs for that size, so ventilate without. And if they don't come around, try again in a minute or two, see if that gag reflex has gone away, and then you can get an OPA placed. Removal of the OPA from your pediatric patient is the same as an adult, just a direct follow the curvature of it right out. So that is how we place an OPA in either our adult or pediatric patient. If you have any questions, you can message one of your instructors.